Hello everyone, welcome to our academic session. Today's topic is data visualization for beginners, which is an essential skill for all researchers and academicians. We are delighted to have with us Dr. Jyoti Prakash Sahoo. He is an associate professor at KIMS Bhubaneshwar. He is also associated with Curious Journal of Medical Sciences and Trials as an associate editor and as an academic editor for PLOS ONE. He also serves on the editorial boards of Discover Medicine, Clinical Pathology, and EC Psychology and Psychiatry. Thank you, Dr. Sahu, for being with us today. I'm sure this session will help us see data in a whole new way.
Today we are going to discuss something on data visualization. Combis quadrid is one of such example. We'll see that. He presented 4 different samples of 11 participants having different parameters. He presented the correlation factor, the mean, the standard deviation, the variance, everything comes same. Everything. So here is the first population. See the correlation, the slope, and the points. Here is the second one, second sample, having the same mean, HD, and correlation, but the pattern is different. Here is the third one. Here is the fourth one. So the tabular format can be deceiving as the mean, standard deviation, the variance, the correlation, all are the same. So that's why data visualization is preferred over the tabular format or just the normal text. We'll have another look, the data source by Albert Cairo. Here are some extensive samples. For example, 13 or 14 samples. Different population having same mean, HD, variance, and the correlation. Just look at the samples. Is one, the second one, the third. Different samples having same mean, HD, variance, and the correlation. Just look at the distribution pattern. Certain sets of population. So that's why data visualization is important. Okay. Some researcher wanted to analyze the box office collection of Shrek movies, all this Shrek quadrilogy, with the contemporary ones. And they found it, they compared it. Two data scientists, data analysts, they analyzed the box office collections and analyzed as per their convenience. This is the first one and this is the second one. Which one seems beautiful, more beautiful? Here is the reaction. This is a common one and this is some unique. Here is the question so that we will move forward. So in the last workshop, we had this assessment of the presentation based on the entire PPT. But here, before beginning it, before going to the next slide, just starting with the question. In the last workshop, we had 90 participants. Just remember the values, then note on the values, note down these values. 90 participants were there. Out of them, 51 were faculties. 51 were faculties. 15 were PhD candidates. 51 faculties, 15 PhD candidates, 20 paramedical staffs were interested for data analysis and visualization, and 4 undergraduate students. They're very keen, very interested, very curious for this visualization part, the plotting. 51 faculties, 15 PhD candidates, 20 paramedical staffs, and 4 undergraduate students. Right? They also rated the presentation. And you have their values, individual values, arbitrary values. So please share your opinion. How do you like to present the data? You have their data, individual data. How do you like to present? All of you said like the bar chart. The group A, group B, group C, and group D with their mean values. This is the standard bar plot, right? To adding extra values, these are the error bars showing the standard deviation, mean along with standard deviation. This is known as dynamite plot. The previous one is bar plot. This is dynamite plot. The bar plus error bar, dynamite plot. Just adding few extra values, mean along with SD, not the distribution pattern. This is for parametric distribution, the normal distribution, the parametric data. Then this is the dot plot, the individual dots. Can you identify the individual dots? 4 dots in group D, 20 dots in group C, 15 in B, and 51 in A. If you count, the numbers will be the same. This is the dot plot showing the individual values, their assessment scores. Better to interpret, it's better than the previous one, the dot plot. That was very clumsy. This is the bee swarm plot. Similarly, draw the imaginary line, like focus on this one, this group D participant. It will be easier. Like this group D participant, this is definitely 4, this is 5, this is again 5, this is 4 above the midline. So 2 have rated 4, 2 have rated 5. So this is B swarm plot. Like B swarm plot is clearer for the larger samples. Like for this one, 51 participant in the group A. Like B swarm plot is wider in the base and narrower on the top. So moving on to the next one. This is the classical Blockson and Whisker plot used for non-parametric dataset or the non-normal distribution. The midpoint, the midline of the box is known as the median. And this is the box. This is the box. The midline is the median. The lower line of the box is first quartile. The upper line is the third quartile. And these two are the whiskers. Median is the second quartile or the 50th percentile. And this is the outlier. You can see it here in the group B. This is the outlier. You can see it here in the group B. This is the outlier. So we can present the data set in this fashion also, box and whisker. In the subsequent slides, we'll do some little bit modification in this box and whisker plot. This is the violin plot. This is the violin plot. It shows the distribution pattern. The width correspond to the number of values in that range. Like this portion is wide for group B. That means most of the value, the majority of the values in group B lies here in this section, like between 4 and 5, around 4. For this one, most of the value, the group 1, most of the values lies here. This was the distribution pattern, but not the median, nor the entire distribution, entire the individual values. This is the box and jitter plot. We have seen the jitter plot. We just merge that with box and whisker plot. Individual points. We can see the outlier in the group B. Individual points and the median, the first quartile, the third quartile, and the whiskers. It is clearer than the previous box and whisker plot. This is the box violin. Here we combined the box and whisker plot along with the violin plot. The violin plot shows the pattern of distribution, and the box and whisker shows the median and the middle 50% of the scores given by the participant in that group. Next is the combination of all three plots. Violin Someone might ask, where is the jitter in the previous one? Where is the jitter? We can find the individual points. So here we combine them. The box plot, the violin, and the jitter plot, combining all of them. So individual data points are there, the median value is there, the distribution pattern is there. This is the Riz line plot. Riz line plot. Like the four groups, just we swapped the axis. The x and y axis have been swapped. Four groups and their quartile values. The first, second, and third. This is the median value. The quartile values here. The first quartile, second, third, and the fourth quartile. This is the median value. The junction between the blue and the orange one, orange or red one. This is the median value. And these are the middle 50%, like shown in box and whisker plot. The distribution pattern, the first quartile, second, third, and fourth quartile. The ridgeline plot for four different groups. Next one is barcode plot. Barcode. It just simply look like say, a barcode on any given product. So each line or each bar, each the smaller bars represent an individual value. So here is the outlier in the group B. It's a different way of presentation. Similar to the dot plot. It is bar. So barcode plot. Suppose we narrow down this bar to a line. Suppose we narrow down this bar to a line and just shorten the distance between the numbers given in on the y-axis. What would it look like? It look like this one. Interval plot. Sorry, the gradient plot. This is the gradient plot. Gradient plot showing the median, like in the dot median, the median values as dots. The whiskers are seen there as the darker shade of this line. These are the whiskers. And the narrower line, in the upper and lower segment, they show the quartile. And the total value, this gradient, if the values are concentrated, like in case of this portion as compared to the upper ones, or in this portion for group B as compared to this one, that means more values are concentrated here. Gradient plot. It is evident from the median itself, median and the whiskers, but still, just by looking at the gradient, you can tell where is the most of the score. For group D, there are only 4 participants, 4 scores, so there is no gradient, no difference in the gradient. In the rest 3 groups, there is some gradient visible. This is the gradient plot. Next is the interval plot. This shows 95% of the data. 95%. Here they have taken 95% of the data of all the given scores. Like the middle one is colored as black. This one, the middle 50%. Middle 50% is colored as black. The middle 80% of the data has been colored as blue. This one. So the remaining 30% lies in the blue shades. 50% and 30%. We can know the pattern of the distribution patterns. This is the 30% and rest is the 15% extra data. This one. And beyond that remains the last 5% of data. So we can do that as well, like one different shade of color, and we can name that as 100% of 1. So these are interval plot. What interval of the entire data set has been represented as different color. It can be shaded as different shades of a single color, or we can provide in different colors to it. The different way of presentation, interval plot. Now this is the plot we just saw in the Surrey quadrology part, the Wren cloud plot. Wren cloud plot. It will be more clear if we swap the axis. Just check it here. If we swap the axis, it will be more clear. Like Wren cloud. See the clouds and the dense clouds as the box and the Wren as the dots or the jitter. You can see the Wren cloud. That is the half violin over there. Half violin which has been trimmed off. The edges has been trimmed off. This is the cloud, the pattern of distribution of all the data set. And this is the box and whisker plot at the dense cloud. And here are the raindrops. So this is known as rain cloud plot. The individual data set, the median values, and the distribution pattern. This is the half violin. So grammar of graphics. Grammar of graphics. So first, for any graphics, we need, what is the basic element? The most basic element is the data set. Without data, the graph doesn't have any meaning, or we can't plot any graph or any table or something else. Right? Data is the basic element. The next part is mapping. What kind of plot would we like to present or want to provide? What kind of plot? We just discussed few examples, few different examples of different kinds of plot for a single given question. Right? That is the mapping part. Then comes the statistics part. Like the numbers in each group. We can mention them in the plot. Or the statistics, the analysis, the tools for analysis, the p-values, different kind of statistical test, we can mention them as well in the graph, in the plot. Right? Then the scales, like what size of the dots. Like in B-swarm plots, the dots were bigger, the circles were bigger, and for jitter plots, they're a little bit transparent. Like for barcode, they are transparent, not for the gradient plot or the interval plot. Right? The scales. Next is the geometry. We can place them as triangles instead of circles or squares or any cross mark or star marks. The geometry. The gap between the group A, the different groups, the gap between the bars, the shades of colors. Then the facet. Facet we'll discuss in the next slide. We can declutter the values. Like group A values, suppose we haven't classified them as on the basis of gender. Say for instance, we want to know what are the differences between male and female participant or younger or elderly participant. So we faceted them. We can facet them as per the gender or the age group or some different parameter. We can facet them or grid them. We'll see them. The next is the coordinate. Coordinate like the x and y axis. We can value like on scale of 1 to 10. We can mention them as 0 to 100. We can mention them as decimal points. So those are the coordinates of the axis. Then the last part is the theme of the graph or the plot. Apart from the theme covers the entire graph except for the plot. So all these elements are different parts of a single graph, given graph. So this is something new. Sankey diagram. Sankey diagram. Sankey diagram shows association between the adjacent parameters. It's an interactive plot. Not here. It's an interactive one. But in the slide, I can't show the connection. Here, the Sankey plot describes the association between the gender, the disease, and the outcome. we can decipher like this, like if the participant has both ARDS and pneumonia, the most like outcome is death. Just focus there, the association. It will be clear on the next one. This we have already seen, this jitter plot along with the median one. The age in years on the x-axis and the specimen, the pathogens on the y-axis. And male females have been labeled as different color. So the participant individual data is there, age group, age data, and the median values. This is something new. Chord diagram. This is chord diagram. Generally used for genetic mapping or genetic analysis, but we can show some association between variables. Like here we have presented like the data of some AST finding, antimicrobial susceptibility test finding for a given pathogen, Acinetobacter baumannii, for 13 antibiotics. 13 antibiotics. They have been abbreviated as per the CLSI guidelines. Just focus on this number, the color, the blue, yellow, and the red one. And focus here. Here, this is TZ-cycline. Acinetobacter is none of the samples, none of the isolates, Acinetobacter isolates were resistant to TZ-cycline. Is it clear here? No red dots, no red lines connecting these two portions. So we can decipher that TZ-cycline is either sensitive or intermediate. None of our sample were resistant to TZ-cycline. Here, gentamicin, this one is gentamicin. No Acinetobacter isolates were sensitive to gentamicin or meropenem or imipenem, not even cotrimoxazole. The colors correspond to the individual drugs, these colors. And likewise, the colors of sensitivity patterns are given here, shown here. This is chord diagram. Just by looking at this, we can simply tell Acinetobacter samples were more resistant or more sensitive to the given drugs. If you analyze the trend of, like, say for instance 5-year trend analysis for AST pattern, the susceptibility pattern, if the trend shifts, then this pattern will shift. The sensitive will widen or it will narrow down. So we'll see the trend for say for instance 5-year or 10-year trend of any given sample or given hospital. We can analyze that through chord diagram. This is the heat map. Like, let me check. This one will be easier. We'll follow this. Like, we have done a study on scrub typhus. So those participants, they had 7 symptoms. All of them had fever. All of them. Right? All of them had fever. And these are the rest 6 symptoms. Done? So someone might want to know what is the co-occurrence pattern of the symptom for any two given patient. Like if someone is having lymphadenopathy along with pain abdomen, or what is the co-occurrence pattern? That is easily interpreted through this heat map. Like S1 is symptom 1 is your fever. You note it down. It is fever. Lymphadenopathy is symptom 2. Eschar formation is 3. Cough, rash, seizure, and pain abdomen. So here symptom 1 and 4. The shade is the darker shade. That means the association is stronger. There is higher co-occurrence of fever and cough. These are diagonally symmetrical. Just put a diagonal and they are diagonally symmetrical. It shows the association or co-occurrence of different symptom. And this is the highlight plot for the same study, for the same symptom or same participant. All participants were there. Only those are highlighted who had lymphadenopathy in the first plot. 29 participants had lymphadenopathy. So here are their age and the duration of the symptoms. Only those participants were highlighted, though having lymphadenopathy. Next is the ester formation, the cough. Likewise, this is highlight plot. All samples are there, or variables are there. Just we have to highlight the required point or required parameter. This is the easy one, the correlation plot. Correlation plot with the slopes. This is the Venn diagram. So we have, this is for dengue patient. It has been mapped for a study on dengue patient. So this color, this circle represents the male participants. So outside this, all were female. The yellow one represents the yellow LFs, represent the elderly participant. Outside this LFs, all are younger participant. This orange one represents the hepatosplenomegaly. This is pleural effusion along with ascites, the purple one, and the green one shows the gallbladder thickening. The problem with vein is that we have to segregate into only two groups. Yes, no, male, female, elderly, younger, black and white, more or less, likewise, present or absent. Then only we can do this vein diagram. Inside vein or outside the vein diagram, likewise. This 37%, just we are deciphering this. This 37 patients were male, younger male, just this is outside the yellow LFs, younger males, not having any of these three symptoms. Is this clear? 37 younger male participant not having any of these symptoms. One elderly female not having any of this symptom. We have seen this already. The half box, half jitter plot. Half box, half jitter. We have discussed the facet now. This is grid version of the. This is patchwork of 6 plots have been patched. So box and whisker and jitter along with the statistical the p values. We have faceted and form the grid. This is the correlation plot. The colors represent the correlation, the exact correlation coefficients. The upper segment represent the numbers, the correlation coefficient, and the lower segment represent the colors. The lower segments represent the ellipse. This is the clock pattern, the lower segment, the square pattern. This is co-occurrence diagram, another one. This is the classic co-occurrence diagram. Just focus on here, the first one. This has been plotted for some COVID, one COVID article on COVID. So the COVID participant, the COVID patients had symptoms like fever. The C stands for cough, breathlessness, myalgia, this dizziness, anosmia, hoarseness of voice, and loose motion. Just focus on this one, the first one. The width of the circle, the diameter of the circle represents the number of participants with that symptom. So which symptom was the most common? Fever, followed by cough, myalgia, and so on. And the connecting bands, they show the co-occurrence, the degree of co-occurrence between the symptom, between any two given symptom. Like for all the participants, the co-occurrence between fever and cough, fever and myalgia, cough and myalgia, those are higher than the rest ones. This is for the entire population, conducted over 2 years, I think. This is the second one. This is for those participants who stayed for less than 7 days in the hospital. Check the co-occurrence. The fever is the most common. Check the values. The breathlessness, the myalgia, the width, the diameter of the circle, and the width of the connecting bands. They show the co-occurrence. This is another Sankey diagram. Yeah. For the same study. The age group of the patient, the presence of asthma, COPD, or was there any no disease at all, whether they are having any symptoms, like the number of symptoms in the third column, and duration of hospitalization in the fourth one. Focus on this one, the elderly participant, more than 65 years. Majority of them had either asthma or COPD. Only few of them had no disease, no respiratory disease during the admission. Of them, this many portion have more than 5 symptoms during admission. Some had 4 to 5 and some had 1 to 3 symptoms. The patients with more number of symptoms during the time of admission stayed for longer duration. Just focus here, stayed for longer duration. This is the association between the adjacent parameters. Shown through the Sankey diagram. It shows the association between the adjacent parameter. Okay. It will be clearer through the alluvial plot. We are going to that. So this is mosaic plot. Like Venn diagram, this also represents the distribution of the sample, mosaic plot. This correspond to the male participant. So just by looking at the figure, you can tell male participants were predominant or more in number in this population, in this. Then this mosaic plot has been grouped as per the gender, the infection type, like catheter related bloodstream infection or the bloodstream infection, or just the colonization, no infection, and the vein used for cannulation, like femoral vein, internal jugular vein, or the subclavian vein. Like check on these columns, just draw an imaginary box here. These are grouped as per the vein used for injection. Which vein has been most commonly used, internal jugular, femoral, or subclavian? Internal jugular. And least commonly used, CV, subclavian vein. Okay, fine. Then focus on this one, the BSI, bloodstream infection. The first, this box, and then this box. Actually, these are grouped. First, they are grouped as per the vein used, then as per the gender, then as per the age group, then finally as per the infection. That's why this is the mosaic plot. As per the distribution, as per the different parameter, the entire population has been grouped, segregated. So the participants with CRBSI are more in number as compared to BSI. Just look at the entire plot. Then we'll segregate. We have 4 parameters here, right? The vein used for cannulation, the gender, the age group, and the infection type. Fine, 4 parameters. The first sequence here is the vein used for the cannulation. This is the margin. Then just focus on the femoral vein. We have grouped as per the gender. Here is one demarcation. Here is the another one. As per the infection, sorry. As per the infection. Here is the second demarcation, second grouping. Just by looking this one, we can tell that male participant had higher incidence of CRBSI, colonizer, as well as BSI. Is that clear? The internal jugular vein was the most common vein used for cannulation. There were more young participants as compared to elderly ones. And there were no young female participants having BSI who were cannulated through femoral vein. This is 0. That's why dotted. This is a mosaic plot. Just by looking at the area of the box, we can interpret the amount of population there. This has one advantage over the Venn diagram for data distribution. Venn diagram will represent either yes or no version, either male or female, elderly, young, symptoms present or absent. But here we are having 3 symptoms, 3 infection, 3 veins. This is the alluvial plot for the same study, same CRBSI, BSI, colonizer, same study. Here are the pathogens involved or pathogens detected: Acinetobacter baumannii, Burkholderia cepacia, the Klebsiella pneumoniae, Escherichia coli, Enterovector Enterococcus faecalis, the Candida albicans, tropicans, Pseudomonas aeruginosa. So just by looking this, we can tell that the Klebsiella pneumonia isolates were more in number as compared to the other ones, right? This one actually it swaps along with the throughout the slide. Like, focus on this segment. This participant had BSI, they had Acinetobacter baumannii, and they correspond to this side. This is not visible to me. Let's minimize this one. Okay, they were discharged. This part where they were discharged. Focus on any given point, like this colonizer part, this big one. This is a colonizer, no infection. Acinetobacter baumannii was detected, but there was no infection, no clinical infection, and they were discharged. Suppose we focus on death only or the outcome only. Just focus on the outcome and we trace back to the infection. Outcome and infection. Most of the participants with BSI, colonizer, and CRBSI, they were discharged. We can trace either way, from left to right or right to left. We can trace, unlike the Sankey diagram, throughout the axis, throughout. They represent the number of participants. Number is written here from 0 to 80. There are 83 samples. Then this is the different type of faceting and forming the grid. Like, this is Beck's depression inventory of some participant in a study, in a trial. Their scores at week 0, week 4, week 8, and week 12 are shown as different grids. We use a different theme for presenting through box and whisker plot. Just check the different themes and faceting. These are the theme. This is the theme color. This is the plot color. This is the facet color. The grid ones. This is the legend color. We can color them as per our convenience. Different types of presenting. Like, these are the jitter plot along with the median values labeled as the green ones. This is little bit confusing. This is the clear facet. This one's clear facet. The group A, B, and C. Facet according to the drug groups, study groups. This is the grid. the facets, then the second group as per the gender, female and male. Same study. This is the violin plot, the facets as per the widget, the baseline widget, week 4, 8 and 12. Same study, different way of presentation. This is the violin. Same violin, different theme, violin and box violin plot. This is the HDRS value, Hamilton Depression Rating Scale, different scores at different time point, like week 0, week 4, 8 and 12. The 3 drugs have been labeled as different colors. Another theme, the same, value same, the different themes and different color. This is WHO quality of life for same study, like week 0, week 4, 8 and 12, showing box and jitter plot. See the box and jitter plot. Most of the values lie here, so the box is represented as a single line. This is the entire WHO quality of life at different time point. 4 different factors of this WHO quality of life. It has 4 parts, 4 components, so 4 different part and their trend of improvement. All the participants had improved quality of life in all the aspects. This is the classic grid presentation for different time points, different factors. These are the 3 drug groups, ABC. This is the diagram, the same diagram, box, violin and jitter plot, showing the difference in HDRS from the baseline. We can see the median value as well as the mean value, along with the post-hoc correction through the Bonferroni test. The Kruskal-Wallis test, the p-value, and here the mean and median values, the data distribution pattern through the violin plot, the box and whisker plot, the individual jitter plots, individual data points. Again, showing the trend for the same study. Here is the change, and this is the individual data set, individual dots for all the points, for all the time point of assessment from baseline to week 16 for the 3 drug groups. The drugs are named here. They represent the color, and the p-value is given here. These are they show the different parameter or the different parts of a given graph or plot, like the statistical aspect, the mapping, the scales, here the scale, the coordinates, the x and y axis, the color, the size of the jitters, the transparency of the box. This is jitter plot along with the median. Again, the grid values, ABCD, four plots have been passed for the same study. This is something different. Like here we have compared 2 depression rating scales, Hamilton Depression Rating Scale and Montgomery-Åsberg Depression Rating Scale, through Bland-Altman plot. Looks like some correlation plot, but this is a little bit different. Like we have compared the mean and the difference between those scores and checked whether the scores have the difference is increased along with time or not. Is there any trend, given trend? Yes. As the mean values increase, their difference also increase. That means they can be comparable. If this is so, like the difference and the mean values if they go parallel, like the mean increases and the difference also increases. This is the final one's animated plot. Of the HDRS value. If you want to present data like through animation, this is one example. We can animate other plots as well. That's the end of the slides.
Thank you so much, Dr. Sahu, for that wonderful and insightful session. Your talk has made data visualization feel both approachable and exciting for beginners, and I'm sure everyone has taken away valuable lessons to apply in their own work. With that, we conclude today's academic session on data visualization for beginners. Thank you once again, Dr. Sahu. Everyone, stay tuned for our next session.